Hello and welcome to the Cleft Mama podcast. This is a supportive space for families navigating life with a baby diagnosed with a cleft lip and/or palate. Here we share real experiences, practical guidance, and conversations with parents and professionals to help you feel informed, supported, and less alone. I'm your host, Anja Paune, and I'm excited to get started. Welcome, everyone. I'm so glad to bring you another guest today. And I'm particularly excited about my guest today because I've tried to track her down for quite a while now. And I first came across her when I searched wide and far for advice or success stories of other moms breastfeeding a baby with a cleft palate. So I found a few stories in different places. There was something on the Cleft page, also on a Facebook group for mothers breastfeeding babies with a cleft palate, and also on La Leche. And reading them all, it turned out they all came from the very same person. So I now finally get to talk to her and ask her all the questions. So without further ado, let's welcome Sarah Muir-Little. Hello, Sarah.
Hi, thanks for asking me to come on.
It's great to finally have you on here and to be able to talk to you. Before we dive into the feeding, can you tell us a little bit about your baby?
Yeah, of course. So my son, Russell, he's going to turn 2 next month. He is one of 2 children that I have. I've got an older daughter called Polly. She's just turned 4. And Russ at the moment is just like any other happy little almost 2-year-old running around and exploring the world. But he was born with a unilateral cleft lip and palate, which was quite wide and extended up into his nose. Both the hard and soft palate were affected. So now that he's 2, he's had those first 2 surgeries to close the lip and to repair the palate. And in terms of breastfeeding, which is really what you want me to talk about today, he breastfeeds. To see him breastfeed, you wouldn't know that there had been any difficulties in achieving what we've achieved. But yeah, it's been quite a journey.
That's just so amazing. And there's so few examples. If there's any other, I've only come across you. And so this is my dream or my goal. If I ever get there, I don't know. I'm still happy if I don't. But I really want to understand how you've done it. And yeah. First, did you have the diagnosis already before he was born? So did you have some time to prepare and maybe come to terms that the journey might look a little bit different?
Yeah, we did. And I think if we hadn't had that time to prepare, I really don't think we would have been in the place that we are now, because it's actually very difficult, like you said, to find any information really on how to have some kind of breastfeeding journey with a baby that has a cleft palate in particular. So we found out at our 20-week scan. I should probably just kind of give a bit of context that we were emotionally quite drained at that point, not only being pregnant and having an almost 2-year-old running around, but my husband's stepfather had been in a almost fatal motorbike accident a few weeks before the scan. And we didn't really know at this stage whether he was going to live. And we knew that he'd never walk again. So we were extremely drained. And so we just kind of went into the scan, as you do, saying, we just want a healthy baby. And the sonographer was doing all his checks, and he'd say, oh, I can see the heart and that looks good. And I can see the bladder and that looks good, and et cetera, et cetera. And then he said, would you like to find out if you're having a girl or a boy? And we said, yes, we would like to know. And he said, oh, I can tell you you're having a boy. And we were both very excited about that. And for me, I thought, oh, that's great. Everything's done. Like, he's told us it's a boy. Let's, move on. And he said, oh, actually, no, wait. I just want to go back and check his face. And you could see on the scan, you could see like a dark patch where his lip was. And the sonographer said, oh, have you heard of a cleft lip? And pointed to his face. And I did know what a cleft lip was. I do know somebody that had been born with a cleft lip. But I hadn't really considered it as anything that I would need to be concerned about. And we don't have any other cleft affected family members. So he said, well, we'll need to speak to a midwife and they'll refer you to the fetal medicine unit, which will provide a more detailed scan, and we'll just check for any other anomalies. And so at this point, I just kind of burst into tears, and I didn't really know what I was crying about. I just knew that this meant everything wasn't going to be quite as easy as it had been with my daughter. And I didn't know what these other potential issues could have been. We had a midwife then that explained, well, because he's seen a cleft lip, that means probably there is a cleft palate involvement as well. And it can be an indicator of other things. So that's why you're having this more advanced scan. And they offered, you can do some genetic testing before he's born and so on. So because I was so upset, they were able to fit me in to see the fetal medicine unit that day. I just had to wait around in the hospital a little while. And so luckily they were able to confirm at that scan that there was nothing else that they could see that was of concern to them, but explained that we'd have every 4 weeks, we'd come in for scans and just check the progress of everything was okay. And at that point, they'd kind of said, well, because the palate is likely impacted, that means that you won't be able to breastfeed. And I almost found this, well, selfishly, I think probably the most upsetting thing of all, because although, obviously there's difficulties hearing that your child is going to have to go through surgeries. That's obviously a very difficult thing to hear. And that there might be all sorts of other complications that they're not quite aware of right, at the minute you're told. I didn't really know how to parent any other way than breastfeeding because I'd fed my daughter. In fact, I'd only just recently weaned her. She was 20 months old at this point, and I didn't want her to be breastfeeding by the time the new baby was born because I'd decided I didn't want to tandem feed. So I just kind of thought, well, like breastfeeding is such magic. If you're out and about and they're hungry or thirsty or tired or bored or being too noisy on a train, one of the solutions is just, well, let's just feed her quickly, And so the loss of that and the loss of the bonding that came with breastfeeding, I really mourned that. And I was really, really quite concerned about how would I parent without breastfeeding. So it was a huge, huge shock and a lot to take on board. But once we'd got the all clear from the amniocentesis, which we opted for, then I could kind of really think about, well, what could breastfeeding look like? Because one of our cleft nurses had said, well, if the palate's involved, which is likely, breastfeeding isn't, it's not going to be the same, but you can have some kind of breastfeeding journey. Or I started to explore what that journey could really be.
That's so interesting. And I feel exactly all those thoughts that you had. I felt exactly the same. But I didn't find anyone who said there is still a way until I found you and your articles or your blog posts. But when I mentioned it to the cleft nurse as well, everyone just straight away said, well, you have to pump and then use the bottles and you can still give the breast milk. And it was the same. I was so upset, almost more about the feeding than anything else. And I think it was quite hard for people to understand why. And I can't really say why that affected me so much or why that is so important to me, the way I deliver the milk. Because they said you can still get the same milk. But it still was very important to me. But there was no one that had ever heard of anything other than using the bottles.
Yeah.
So how did you find out about it and what did you do in the end?
Yeah. So I did start looking around, and I'm sure all the same kind of things that you did. Went on the Clapper website and looked at that, and there were examples of, you could put expressed milk on your breast and then the baby could lick it off. And I was like, okay, well, that's not really breastfeeding. That's just, some element of trying to mimic it. And I did find a couple of examples where people had managed to breastfeed their babies after their palate surgery. But it was only sort of one or two. And when I found those articles, I was so excited and hopeful and, shared them with my husband and said, look, maybe this is possible, and started reading a bit more about it, about different methods, because there's plenty of countries that don't have access to the support and these special bottles and everything. And, that doesn't necessarily mean that the babies don't survive. So people are feeding their babies that have clefts. So I kind of looked into what what the common themes were for these success stories. And it seemed to be, firstly, you obviously need to maintain your milk until the baby has their palate surgery. Secondly, the baby needs to be fed at the breast until their palate surgery, because once you get to having the surgery, and if they've never fed at the breast, like, they don't understand that boobs are where the milk comes from. And I had read stories of people that had expressed with the aim of then trying to put their baby on the breast after palate surgery, and it hadn't worked because the baby was just like, why are you putting it? You might as well be putting an elbow in their face. They don't understand that that's where the milk is coming from. And the third one was, I knew that there would need to be some recovery time after they had the surgery to help all those muscles heal before we could really attempt feeding. And one of the stories that I'd read, it was many months, I think so 3 or 4 months after the palate surgery had been done, that the baby finally managed to feed themselves. So I knew that we're going to need some kind of patience. So for each of those elements, I started trying to research, okay, how can I give myself the best chance? So for the milk, I was lucky because I'd breastfed before. So I knew that I had enough milk to feed a baby. I knew that second time round, you often produce more milk. And although I had absolutely hated pumping with Polly, my daughter, I knew people that had expressed milk for many, many months, like up to 10 months. So, I knew that that was possible. And I sought some advice from a lactation consultant. And we had a session, this wonderful lady called Thomasina, and she came to the house and she described to me what I would need to do to have the best chance of successfully pumping enough milk to feed the baby, and also not just go completely all consumed by pumping. She said, well, yes, you're going to need to pump 8 times a day, and one of those needs to be overnight in this crucial window between 1 and 5 a.m., but you only need to pump for 15 minutes. And if anyone tells you need to pump 10 times a day, 50, just ignore them. Just do your 8 times a day. It'll be fine, kind of thing. And we talked about the potential holds that you could use to feed a baby that was cleft affected. And generally the advice is that this dancer hold or koala hold. And that seems to be more about plugging the cleft in the lip to create a bit of a seal, and also holding the baby upright so that there's less milk that's dribbling down. But she hadn't actually she hadn't dealt with anybody that had actually had a cleft affected baby before, but she was great at preparing me for pumping, which was fantastic. And then the other thing was, I needed to work out how I was going to feed the baby at the breast for such a long period of time with the expressed milk. And again, I researched different stories, and this was me just trawling the internet, hours and hours and hours of searching of all the different terms I could think of to try and gather these stories. And whenever there was a success story, I tried to contact somebody for some help, and I didn't really get very far with that. So the 2 methods that I had read about that were successful, there was one lady that had hand expressed every single feed into her baby's mouth. So she was holding the baby, they were latched on of their kind of capabilities, and she would be squeezing the milk into their mouth. And I just thought, oh my word, that sounds like a lot of work. Like, I don't think I could do that, but that's too much. And then the other success stories that I had seen were the supplemental nursing systems. Now, this was quite helpful because there was lots out there on supplemental nursing systems, just not necessarily for cleft affected children. It is something that is more common in, say, if the baby has to go into a newborn intensive care unit or something like that, or there's lots of reasons that they're used. I knew someone that had tried to use it when their little one was born. They said it was horrendously fiddly and they didn't get on with it at all. So I thought, well, okay, I'm going to need to research this and work out what's going to be best. And in the UK market, there seemed to be 2 different brands that were available that would be suitable for feeding a cleft affected baby, because they can't suck, so they're going to need the milk delivered rather than them just sucking it themselves, like they would do if you were just supplementing if you had low milk, for example. So the 2 brands, there was the Hacker, which comes with a squeezy bottle, and then there's the Medalla system, which is gravity fed. And so I bought them both and I tried out how I would even hold them. I used one of Polly's dolls and pretended that I was feeding it whilst holding this system. And both of them were just very difficult. But also the Medela, the gravity-fed system, the flow of milk was so slow. And I thought, well, that's fine for a newborn, but we're going to need to feed Russ until, well, I didn't know his name then, but we're going to need to feed our baby for probably a year before we can think about him even feeding himself. And he's not going to be satisfied with this little trickle of milk. It's just not going to work. So I thought, okay, well, let's go with this squeezy bottle system. But again, I'm not convinced because it was very cumbersome. But then I realized, well, the Medela system, it comes with a syringe to clean the tube, because both of them have this thin tube that you attach to your breast so that the baby is getting the milk that's delivered from either the bottle or however else you're doing it. And I thought, well, actually, a syringe of milk going into the tube would be much better because you can fill up a syringe, and if you put it down, it's not going anywhere. It's not like a bottle that will start to leak. And a syringe is much, slimmer. It's easier to hold. In fact, when I actually started feeding, I found it really helpful. I could just tuck the syringe under my vest top or bra strap, so it would stay in place when I was needing to do something else that wasn't feeding for a second. So yeah, I thought, great, let's try and attach the syringe to the tube. But at that point, Russ was born, and so all kind of research paused because I've got a tiny baby to deal with. And when he was first born, I'd expressed a lot of colostrum and kept that in the freezer in very small tubes. And so we were feeding him with that colostrum with a finger in his mouth just to promote that sucking and swallowing. And that was a technique we'd actually used with my daughter. She struggled to feed when she was first born. She was born in a heat wave. And so she was just too tired. And then she didn't have the milk. So she was then even more, tired and depleted of energy. And so we'd sought the advice of a lactation consultant then, and they said, well, for the first 6 weeks, you don't really want to use bottles. Stick with this, either trying to feed her from a cup, which was very difficult, or put your finger in her mouth and use the syringe. And that had worked really well with her. So we thought, okay, let's give that a go to feed Russ initially with the express colostrum. And that's what we did actually for 6 weeks. We just fed him with a syringe and with the finger in the mouth, while I was trying to suss out really how could we feed using the SNS.
This is also interesting because I don't know if it's the same person, but you mentioned the person who's hand expressing into the baby. And I've come across this German lady. She was a lactation consultant as well and a midwife. And she had 3 children and 2 of them were cleft affected. And she hand expressed, and she named the method after her as well and her son. So she was Ulrike Giebel and her son is called Linus. So it was the Giebel-Linus method, or GLM, which you might see. But then she realized that they didn't create quite the latch that you would need to then move onto the breast. So she further developed that method, and she introduced finger feeding in the beginning and later syringes and tubes, and then the supplemental nursing system. So you seem to have discovered everything that she recommends, but you've discovered it all by yourself and kind of did it all the same process as what she now recommended. So this is where I got my knowledge from and what I try to follow as well. So I started with the finger feeding as well and didn't give the bottle. And all his feeds in the first few weeks were from me at the breast. But then unfortunately, we had a family emergency, so I had to travel. And then my baby was away from me several hours in the day for over a month. So then he had to use the bottle, but there was just no alternative. So now I'm seeing if I can go back to the breast. We will see. But yeah, it's so interesting to hear that it worked for you. So yeah, let me know how it went from there then.
Yeah, sure. So at this stage, I was at the point where I knew I wanted to use the syringe plus the tube. And I just needed to work out how to get the syringe and the tube attached. And I'd tried ordering some different food grade tubes to see if I could attach it to the syringes I had, and nothing was really working. But we actually ended up with having some very small syringes from the hospital, and the end wasn't the right type for doing the finger feeding. Rather than the long kind of tapering end, it was this end-fit system where you screw it into whatever you want to screw the syringe into. And just by chance, that fitted the tube. Now, these were really tiny syringes. They were 3 mils. But we were very lucky to be supported by a home birth team. And they were able to get different supplies for me from the hospital. And one of the home birth team brought around a selection of syringes. Some of them the ends fitted, but also some of them came with caps that you could screw onto the end of the syringe. And so I thought, okay, well, let's try drilling a hole in the end of one of these caps that would fit the tube snugly enough that it would stay in place. And then you can just screw the whole thing onto the syringe. And that's what I did. And as I wrote in my blog, which I definitely would encourage anyone trying to do this to read, because it's got all the sort of technical details. It's cleftfeeding.blogspot.com, or one word, cleft feeding, like breastfeeding, cleft feeding. I definitely hadn't imagined sort of one week after giving birth that I was going to get my drill out and start trying to do some DIY. But I drilled the hole in the top, in the cap, and the tube fitted. And I actually just used that same cap for the full time that I then needed to feed Russ. I never needed to make a new one. Like, just one was fine. It didn't ever wear out or anything like that. So that meant now I had these 20, well, I think even up to 60 mils syringes ready to go that could just screw onto the tube. And then I just needed to work out how to hold Russ and the tube and the syringe. And that all still felt quite fiddly. So I decided, even though the general advice is try not to tape the tube because it's a bit of a faff. And if you do tape it, you need to tape it very far away from the mouth so you're not disturbing the latch and so that the tape isn't getting wet. I thought actually the easiest thing for me to do, and to make sure that I've got the right amount of tubing in his mouth, is to tape it very close to my nipple. And that in itself was quite tricky, because that means then the tape is part of what goes into the baby's mouth. And so it's got lots of milk on it all the time, and it kept coming away. And we tried quite a few things, different tapes, different positioning. And my husband suggested that we put a small amount of tape directly on the tube itself, just wrapped around the tube to give it some grip, and then grip that bit of grippy tube onto the nipple. And that worked really well. There was still milk that got lost, and there was you'd feed and then you can't reuse the tape or anything like that. It needed to come off or sometimes be redone in the middle of a feed. But it was good enough that it meant I could get enough milk in through the feed. And at this stage, we were also still trying to do this koala, this dancer hold, which you kind of sit the baby upright on your lap. And it was such a fiddle. And I just thought, this is, no one is having a good time here. And Russ would get very upset and I'd get very upset. So we went to see somebody in the speech and language team at Great Ormond Street, who comes from, I think it's New Zealand. And there, using a supplemental nursing system is a much more common approach for feeding babies. And she was able to just give us some advice. And I'd fed Polly, my daughter, in the ordinary cradle hold. And she said, just do what feels natural to you. It doesn't matter that it's not this particular hold that's going to maximize the amount of milk that goes in the mouth, because actually what you need is just a calm baby. So then we said, okay, well, let's try it in the cradle feed. That's also much easier to hold the syringe. I could support him sort of with one leg as well. So I'd have my arm a bit freer, and it was relaxed. And I just made sure I had a really deep latch so the milk was not flowing out of his mouth. And that's how we then fed until his palate surgery, really.
How would you define a latch? Because they still can't kind of suck the nipple into their mouth because they can't create a vacuum. But is it you feel like there is a seal even though there's still a gap in the lip, or were you happy with the type of latch he had?
Yeah. And this is quite difficult to explain unless you're seeing and also if you've felt breastfeeding before. But as I understand it, a baby up until about 12 weeks has an instinct to latch and to try to suck and to use their tongue to get the milk. So I knew there was never going to be a seal, and I knew that I couldn't feel suction. But I can see that he's trying to suck and he's trying to swallow and his tongue is making that action. So yeah, I felt, well, the rest of his mouth is making a seal, and yes, there's a gap where he has a gap, but everything else is in the right place. And I can feel that he wants to feed. So surely that's enough. And in my head, I was also thinking, well, hopefully by the time he has his palate surgery, well, maybe I didn't really even know, but I just thought he'll hopefully figure it out. You know, if he's always done what he thinks he's breastfeeding, and if he's always done that same thing, he's not going to lose that instinct. And so if I just continue feeding him at the breast, then he will continue thinking he's feeding. And then when he actually has the muscles to create that suction, then yeah, that should work. And he had his lip repair done the day before he turned 5 months.
Mm-hmm.
And from then, obviously, you can see that there's a seal and you can tell that there's no gaps left. I know he still doesn't have any suction, but you can tell that he's trying to feed and there are no gaps for the milk to start running out of. And by this time, we'd stopped using the tape, so we didn't have that problem with the milk dribbling out because of the tape. So by that stage, by the time he'd had that lip surgery, there was a good seal, and any milk that went into his mouth stayed in his mouth and was swallowed.
So how did you hold the tube in place without the tape then?
We just were better as a pair at knowing what to do. So we'd had lots more practice, because obviously when a baby's born, yes, they've got this instinct to latch and to feed, but they don't really know 100% how to do it. And when you start feeding, you need to learn, well, if you're feeding for the first time ever, you need to learn what works for you and how to hold the baby and what it feels like to have a baby actually sucking and swallowing. So when he was very little, we were working that all out together. And quite quickly they learn, like, okay, what position do I need to be in order to feed? And so by the time we stopped using the tape, which was around 10 weeks, he knew what position he should be in to get milk. And so he'd get into the right position. I wasn't needing to position him. And I knew which position I needed to be in and whereabouts the tube needed to be. So at first I kind of just taped it a little bit further. But I think really after 1 or 2 days of trying to sort of slowly change where the tape was, I just thought, this is silly. And I just managed to hold the tape onto my boob and put him on at the same time, or just get him on and then put the tube in afterwards. But I found that wasn't quite so successful.
Yeah, that's just amazing that you even managed it without any tape. And
yeah, and that was something that I'd read on one of these success stories from an SNS that wasn't anything related to a cleft baby, if I remember rightly. And they said the sooner you can ditch the tape, the better. Like it is great to learn how to do it. And when you've got a very small baby and you're trying to juggle lots of things and they're crying and whatever, and you just want to set up quickly and know that it's going to be in the right place, that's great. And also, actually, we'd received a comment from one of the community lactation consultants that I'd seen, that they were concerned and they didn't want to give me any of the supplies that the home birth team had so kindly sourced for me, because they were worried that we would put the tube too far into his mouth and that he would choke on the milk. And I just thought, well, that's not a very helpful comment. And like, I can see if he's choking, and I know how far I'm putting this in. But actually, when I went and spoke to them, they invited me to go and do a demo to their full team once we were up and running with this feeding, so that I could kind of almost train these other lactation consultants on, this is actually possible, and it's not just for cleft affected babies, but this has much farther reaching possibilities. And they mentioned that previously they had an instance where a baby was born with a cleft palate that hadn't been picked up. and somebody was feeding with them with the SNS, and they had actually the milk managed to go sort of too far down their mouth. But yeah, I just kind of put that comment to one side. And actually, at that session that I went to with the sort of training, information sharing with those community lactation consultants, there was one woman that came up to me afterwards, and I'd said during the session, look, I don't know if we're going to get there. I don't know if he's going to feed himself after the palate surgery. I don't know if we're going to be able to continue with all this expressing, and it is a fiddle. And I was very lucky that my husband had a very long, I think it was 4 months paternity leave. So he was a great support in doing lots of washing and also just being able to hold Russ or look after Polly so that I could pump. He was really, crucial in this early stage. But I'd said, well, every day that he is getting milk from me, that's a benefit. And even if we don't make it to direct breastfeeding, he'll have had all that amazing milk. And if he feeds at the breast, that's even better, because then, I don't know the mechanics around this, but your milk's supposed to be able to respond to what they need because you've had that contact. And someone came up to me after the session and she says, I know you said that, you don't know if you're going to get there, but I believe in you. Like, you can do that. And every time I think about it, it makes me want to cry, because if she hadn't, she was one of the few people that said to me, like, you're going to do this. So yeah, sorry. Yeah, so her support was amazing. And that's it. I don't know who she is, just, this one line. But yeah, she had a real impact.
You already mentioned the lip surgery. So did you get straight back to this after the surgery, or was there a short time where you maybe were doing finger feeding again because everything needed to heal? Or yeah, how was that surgery? And then the even more crucial one, the all important one for the palate closure, how did that all go?
Yeah, so for the lip, I mean, we had a very difficult time in hospital with the lip surgery. The end result is absolutely amazing, and these surgeons are honestly like miracle workers in terms of what they do. But the recovery in hospital for Russ was very difficult after his lip surgery. And I don't think I'd prepared myself quite enough for it. Even to the instance where, when they said, oh, you can go and collect him. And so we went into the recovery ward, and I was like, oh, that's Russ, that's the back of his head. And then the nurse turned round, and I just couldn't even recognize him because his face was so swollen. And, he still had blood and things on his face, but he was just so puffy and sad and tired. I just thought, this isn't my happy, smiley baby. Like, that was really difficult. And he'd had morphine during the surgery. I think he just was very, very groggy. And the surgeon had said, don't try and feed him early on. No matter, the nurses will want you to feed him because they want him to demonstrate that he can feed and so on. But he said, you don't need to rush it. Stay here as long as you need to. But Russ had kind of wanted to feed and was crying as if he was hungry, because at 4 months, that's kind of, that's all they can do really, isn't it? Cry. And it's only because they're hungry or bored or tired or something. And I thought, well, okay, we'll try to feed him. And I did give him a very small feed with the SNS, which went well. Only very, very small feed, and he went to sleep. But after that, when the morphine, I think, really fully wore off, he was really unhappy with feeding. He didn't want anything to do with milk. And I think we were a bit too led by the nurses trying to say, oh, how much milk has he had? And wanting to be able to say, oh, he's had, this much. And also all his painkillers were given orally. So all of his paracetamol and ibuprofen, that was all through a syringe orally, because we'd had a bit of in theatre, because he was so small, not any smaller than any other 4 or 5 month old baby, but they said they'd struggled to get a line into him to give the intravenous drugs, and so they'd put it in his groin rather than in his foot or his hand. And that's fine for when he's in surgery and lying very still and, they've not got any clothes on. but you can't go around wearing a nappy, being conscious with a needle sticking in your groin. So that came out in surgery, and they put another line in his hand or his foot, I don't remember, but it never worked. So all the painkillers that we were hoping to give him intravenously, we weren't able to.
Yeah.
So that meant everything was orally, and obviously he just had this massive operation. And so he was just very, very upset whenever we were coming to give him milk or painkillers, which was every couple of hours because, he's on this schedule. And we'd have to just distract him with dancing or lights or bubbles or anything. And it was like that for quite a while. For, I think, about 2 weeks, he was really very unhappy. And at the time we thought it's because the painkillers weren't high enough and he was in pain. But I think he just he was in pain initially and then just got this awful association. And for the first few days, he would have a bottle, and we were using the Dr. Brown's bottles, but with a mam teat previously, because the mam teat seems to be more suitable for babies that have a wide cleft lip. But because I didn't want to give him a squeezy bottle, because I wanted bottle feeding to still be an effort for him so that he wouldn't prefer the bottles over the breastfeeding.
Yeah.
So we'd use the Dr. Brown bottle so that he was having to bite on that teat. So, and then we thought, okay, well, let's switch the teats back to the ordinary Dr. Brown bottles because they're, smaller and they might just be less uncomfortable on his lip. They had just had the surgery. And for, a couple of days, he would take the bottle with a lot of distractions going on. But after that, he pretty much rejected the bottles, which my husband found really difficult because up until then, my husband had done all of the night feeding, every single night feed, unless, he was away or something. He'd done all those night feeds so that I could pump in the night. And he'd always given Russ his end of night, sort of end of evening feed ready to go to bed. And that was a really wonderful bonding experience for the two of them. And then suddenly out of the blue, that was taken away and Russ just didn't want a bottle anymore. He would only feed with the SNS. And up until then, it'd kind of been 50-50 in the day, really. When it was both my husband and I around, he would happily take a bottle and happily feed with the SNS, because I thought, well, he doesn't need to have all his feeds with the SNS. He just needs to know that milk comes from the breast up until his palate surgery, and he has to not have a preference for bottle feeding. So we've kind of managed it quite flexibly. But yeah, the lip surgery was much tougher than I had anticipated because, Russ just was so unhappy. But once he'd recovered, and it probably took about 7 weeks until he was fully back to his happy self. And it wasn't until he kind of started singing to himself again that I knew he was fully recovered. And then when the palate surgery came around, we were just, we were so apprehensive about it because we'd had this experience with the lip surgery. But we had really, really good luck with the palate surgery because when we went in, the anaesthetist said, well, actually, I don't use morphine, I use fentanyl. It's a much cleaner drug. It gets out of it doesn't leave you in the same groggy sense that morphine does. And he said, I bet you'll have a better experience this time. And we did. And we'd also, for some reason, been placed on a private ward. So we had our own room, which meant that when Russ came back from surgery, and we both agreed no observations this time, the waking him up every few hours to take his pulse and his blood pressure, he just needed to sleep. Like, he was fine. I can tell that he's fine. He's breathing fine. Like, he's there. So we'd agreed we weren't going to wake him up for any observations. So when he went to sleep after his surgery, I could turn the lights off. There was no one else in the ward. There was no other noise other than his sound machine. When anyone came to do observations, I just refused them. I said, if you can do something without waking him up, that's fine, but you're not doing anything that would wake him up. And this time around, he also had a feeding tube. So that meant overnight, I could top him up with milk when he would normally have a feed. With no interruption to his mouth. And I was able to give him all his painkillers that way as well. So he just had this major operation, then just had a really lovely long sleep with a full belly and all the pain medication that he needed. So when he woke up in the morning, he was pretty much ready to go. He seemed fine. to the point where it got to the afternoon and he kind of took his first few real steps in hospital. He's just 11 months. And the nurse came round and he was either, starting to walk or charging, crawling around the ward. And she was just like, this baby needs to get out of here. Like, he is fine. You don't need to keep him in. And he was taking milk with an SNS, like totally fine, just, smaller volumes than we'd normally give him. But like, yeah, he was totally fine. So we were discharged after only one night, and we thought, well, this surgery is the more complicated one. And we thought that he'd probably be in for a few nights, but yeah, we were home within one night. And it was still the same. He still took 7 weeks until he was happy enough to be singing again, but he was almost back to himself almost immediately, which was amazing. And the surgeon had said, I don't want you to try and get him to suck for a whole month after his surgery, because all of that muscle needs to fuse properly, I guess, and heal, and just otherwise it can create this, a hole where they'd done the surgery. So I thought, okay, fine. And so the surgeon said, just don't change anything. Just carry on feeding him the way you have done, which is fine. But Russ isn't the same. He now has these muscles. So I can do the things that's exactly the same. I can carry on feeding him the way that I'd always fed him. But it is different because now Russ does have those muscles. And the first time I went to feed him after the surgery, I could feel that he had suction. And I just thought, oh, okay, he's not supposed to be sucking. So I had to start delivering the milk much quicker. And up until then, I'd done very paced feeding in the same way you would if you're trying to pace feed with a bottle. If Ross was sucking, I would deliver the milk through the syringe. When he took a pause, I would take a pause. If he doesn't seem that interested, I'd deliver the milk much slower and being really responsive to him. But because I didn't want him to be really using those muscles, I had to start delivering the milk much quicker so that he wasn't really sucking, he was just swallowing. And I also let him get really sloppy with his latch. So I would let him have a little hole in his mouth when he was trying to feed, because that air that was getting in was then preventing that suction from happening. And so we fed like that for a month. And I thought, well, I really hope this isn't going to sort of ruin the chances of him being able to feed, because he's not really sucking and he's not really making a proper seal again. And then one day short of a month after the surgery, we were on the train and Russ needed a drink of water. And I have a bottle with a straw. And so normally I tip the bottle upside down to get the water into the straw and then put that over Russ's mouth so that he can just drink a bit of, he can't suck through the straw, but he just gets the water that's been in the straw. And he did that, and then he just was playing with the bottle. And then he took the bottle straw and just started sucking. And just with no prompts, no like physio exercises to get him to learn how to suck. Like, he just did it because in his mind, he'd been sucking his whole life. So I was like, oh my goodness, like this is it. He's a month in and he's sucked water from this bottle. Part of the straw was clear, so I could see there was loads of water going in, like it was normal sucking. So then the next day I went to feed him, and yeah, I could feel that he had some suction, and I kept him on the breast while I went to go and refill the syringe of milk. And he sort of just carried on sucking and he was swallowing. So I was like, oh my goodness, he's actually getting milk directly. And at first there were lots and lots of sucks to one swallow. And I can't remember what the ratio is that lactation consultants like, but it's, 3 sucks to 1 swallow. And he was needing 6 or 7 or 8 sucks to get enough milk that his mouth would be full enough to swallow. So I know he didn't have a really strong suck, but it was there. And his latch was still a little bit sloppy because, it had been for the last month. So we had to really work on that. And he would often come away from the breast to swallow. He'd leave a little gap to do that. But we tried different holds in order to help with that latch. And I found that laying him on my lap and really leaning over so that there was a lot of breast tissue in his mouth, that helped him remember again, okay, how this latch needs to feel. And then he could just work on strengthening that suck. And at first, he didn't always get the milk that he wanted to. And especially when I first put him on the breast for any feed, I would start off the feed with some milk because I didn't want to have him to wait for a letdown. I wanted him to be rewarded every time he sucked. So if I could tell I wasn't having a letdown, or if it was the very beginning of a feed, I'd give him a bit of milk. And then when I felt my letdown happen, I would then stop the SNS and he would start sucking directly from my breast, which just was incredible. Like I just thought, like, I cannot believe that we've got here. When I started out the journey, like I said, every day was positive. And I had a star chart. And in the very beginning, every day that I pumped, I gave myself a star. And every day that I'd pumped and fed with the SNS from a few weeks in, I gave myself a star. And then the days were not so hard anymore and it changed to weeks. But it was still every week I was giving myself a star on this star chart just to document, like, yes, this is amazing, we're doing it. And then, there we were, like, 13 months in, and he was able to feed himself. And I carried on pumping for another few months because he was still improving with his sucking and the muscles and the coordination and everything like that. And then we went on holiday as a family to visit some friends in Chicago, which is a 6 or something hour time difference from us. And so he woke up in the middle of the night and was sort of wide awake. And I just thought, I'm going to put him on the boob and just see if he'll settle in the same way that I would have done with my daughter. And for about 2 hours or something, he was sat just sucking, but I didn't know how much milk he was getting, but just sort of to comfort and to try and get him back to sleep. And he did sleep, which is also amazing because, he'd never fed to sleep because feeding had never been that comfortable, I guess, for him. But when he came away from the breast after that time, I could feel that actually they felt kind of empty. And then when I went to pump, I was getting virtually nothing. And I hadn't ever struggled to pump a decent volume for his feeds. And I just thought, well, this is it. Like, I'm just going to stop pumping because he can clearly get enough milk that he's happy and that I don't really have anything left. Well, not anything left, but, it's a lot more difficult to pump on an emptier breast. So yeah, that was it. And that was, I think, November time last year. And we're now in July and he's been feeding ever since. And it took a couple of months probably to get his latch perfect in terms of no little gap. And he'd often have his tongue sticking out a bit, but the seal wasn't broken. So that didn't really matter. And also over that time, he started being a lot more interested in milk. So when I'd fed my daughter, both of them had been able to ask for milk since 6 months old because I signed with them. So they knew the sign for milk and they would ask for that. And my daughter was very much like, if she was uncomfortable in a situation or she was tired or whatever, she would sign for milk. But Russ never did that. But over the last few months, he's definitely been more sort of asking for milk when he wouldn't normally have it. Now he's nearly 2. Well, we're actually kind of thinking about stopping. But he sometimes has a morning feed and always has an evening feed. Since I went back to work in October, I don't really do any feeds in the day. But the last few months, he has sometimes come over in the middle of the day and asked for my milk. So yeah, he obviously gets not only the nutrition and everything, but he clearly has a bit of comfort and so on from it now, which is lovely.
It's incredible. It's incredible. Like, because they say the babies are primed in the first few weeks, and you got there just in a different way. It's amazing.
Yeah. I still can't believe that we've done it, but also now it feels so normal when I talk about this whole journey. And oh yeah, we did. It was a real struggle and there's so much research that went into it, and there's so many people that I needed support from along the way. I really can't believe that we did it all, but I'm very stubborn, so I think that helps.
Yeah, well done. Well done. And you need to continue your star chart because you still deserve all the stars.
Yeah.
After the palate surgery, then obviously you said there was this time of a month not really attempting to have a proper seal or proper latch to not create that vacuum, and then you drank from the straw. Did you then still wait for a check off by the Cleft team that they checked that everything had healed up and there's definitely no fistula?
They did a post-op check, but I didn't really change anything to do with my feeding. No, I followed their advice that it would be 1 month and left it with the 1 month, and then he was fine.
Yeah.
And you said, tell me a little bit about your journey.
Yeah, so my son, very similar to yours, we also got a diagnosis at the 20 weeks. And then also they said cleft lip. They don't know about palate, but likely. And it was a quite wide gap it into the nose, one-sided, cleft lip and palate. Yeah, so then I found this German woman that I mentioned and followed her method. So it was first colostrum syringes, then finger feeding as well, then syringes and the tube, and then eventually getting to the supplemental nursing system. And on that, she actually made some changes to the Medela one, because like you said, it's really, really slow flow. So she recommended some tubes, which are actually gastric tubes, so they're thicker, so the flow is much faster.
Oh,
And
okay.
you hang it a little bit higher. So there's also a photo of me floating around where I have it like attached to my hair, basically.
Oh,
So you just
right.
have more gravity to just go a bit faster.
Yeah.
That being said, I'm now working with another lactation consultant, and she mentioned that Haka has now got a new system, and I actually got it in the post just yesterday, which is for not directly for cleft babies, but for babies who can't really suck themselves. So it's not just the additional support. And that has also like a little wheel where you can really regulate the flow. And it's also a much thicker tube to start with, but you can have a more regulated flow with a wheel. So I'm trying that out whenever I get the chance.
Yeah, we had the one with the wheel, which was really helpful at first with the new. It was a bottle with and the tube had a wheel on it, which was really helpful. And I also used that as a bit of a break. So if I had only half used the syringe, I would put that on as a break so no milk could come out, and I would put it back in my little cool bag that I carried around with all the milk and the pumping stuff, so that I didn't have to keep decanting all the milk each time. And I just thought, well, if it's in there and it's clean, it's fine.
Yeah. And she said that this tube also fits onto the Medela one. So this is the combination I want to try next, because I just happen to have the Medela, because I have a Medela pump. So then the bottle fits onto the supplemental nursing system directly, like you pump it and then it fits directly on there.
Yeah.
I'm going to try that out. Yeah. And see, this is where I like the method of just hand expressing into his mouth, because then I didn't need all that setup, because it's literally there with me already. So the recommendations I followed, like I said, from Ulrike Giebel, is to hand express maybe the majority of the day, because then you can be out and about and you have everything on you. But she was really quick, still use the supplemental nursing system at least once, so they can still practice that latch.
Yeah, well, I mean, you just have to find what works for you, really. I knew that syringe system was I was determined that syringe system was going to work. And once I'd put it all together and tested it out, and then we'd found the feed, the hold that works better, then we were off and away.
Yeah, well done. Yeah, I'm still hopeful that we get there eventually. We'll see how it goes. But thank you so much for talking to me today.
No worries. I'm happy to help.
So interesting.
And if anyone would like further information, then definitely they should check out my blog, cleftfeeding.blogspot.com.
Yeah, and I'll put the link in the show notes as well.
And I'm always happy to receive messages through there, or any of the Cleft breastfeeding Facebook groups and things like that.
Thank you so much.
No worries. Yeah. Thank you. Bye.
Thanks. Bye.
Thank you for listening to the Cleft Mama podcast. I hope you get a ton of value out of our time together. You're not alone in this journey. And remember, you're doing an amazing job. If this episode helped you, please follow and share it with another parent who might benefit from it. See you next time.